নমস্কার, আমি মৈত্রেয়ী। আপনারা দেখছেন জি 24 ঘন্টা। আর এই মুহূর্তে আমাদের সঙ্গে যিনি যুক্ত হয়েছেন সুদূর সাউথ আফ্রিকা থেকে, তার নাম ডক্টর অ্যাঞ্জেলিক কোয়েৎজি। ইনি তার একাধিক পরিচয় রয়েছেন। তিনি চেয়ার অফ সাউথ আফ্রিকান মেডিকেল অ্যাসোসিয়েশন, কিন্তু তার সঙ্গে সঙ্গেই তিনি প্রথম যিনি ওমিক্রন ভাইরাসের যে স্ট্রেন, অর্থাৎ কোভিড-19 যে স্ট্রেন ওমিক্রন, তাকে ডিটেক্ট করেছিলেন। ডক্টর কোয়েৎজি, ওয়েলকাম টু জি 24 ঘন্টা and thank you so much for giving us this time. I'd like to ask you first, how did you know that something is not same with COVID-19, the usual variant we have seen in past, and what were the symptoms where you find different and needs your attention?
Thank you for asking. You have to understand that we just came out from our third wave, that was the Delta wave, and for 8 weeks we haven't seen really any new COVID cases. And I myself personally had treated over 600 Delta patients, so I know the clinical picture. When this patient on the 18th of November presented, young man, early in the morning, presented with fatigue, headaches, body ache and pain, thought that he thought that he was having sunstroke because it was quite hot. I examined him, didn't fit, and I tested him and he was positive. I then tested his family, they're also positive. And during that day, I saw seven, at the end of the day, I had 7 patients, all with more or less the same symptoms, not typical of Delta, no loss of smell, no loss of taste, no problems with the oxygen or with elevated pulse. I then alerted the advisory committee on vaccines from the minister and said, listen, I have seen a very, very strange picture today. Simultaneously in the background, some of the lab technicians also spotted on the PCR from other patients that it was abnormal. And our scientists then did sequencing, and it took them 5 days later to say to the world, indeed, there is a new variant. By the time it was announced to the world, we at clinical level had already seen these patients for 7 days and trying to figure out when, what's going to happen, because Delta is in your mind. You know what happened with Delta patients. And then we start to realize, but this is much milder symptoms at community level with Omicron.
So now all we know about Omicron is it has a very high transmissibility. And can you put some light on this, like how infectious it is? What are the rates? Because we have seen the numbers, it's spreading from one country to 80s. But if you can, put some light on it, what you could see on ground.
Thank you. I think also that's very important. So it is highly transmissible. So it is highly infective. Okay, but is it highly dangerous? At community level, we don't see that. So it's a highly infective. It spreads quite fast. In the beginning, South Africa also saw doubling of their numbers. And but now it had stabilized. And remember, we also ask our patients to go and get tested when they have certain symptoms, because it's important for us to know that if you are positive, that we either see you and treat you and get you to isolate or quarantine.
So now, if we talk about the threat perception, because now you have seen a lot of patients, you yourself have treated the 0 patients or the first patient of Omicron. So how bigger the threat is? I mean, what is your assessment? Like, what do you think about this?
So I will rather stick to South Africa, because it seems to me that Europe and that doesn't matter how many times we are saying this is what we see. In Europe, apparently, it is a severe disease, and we cannot make it lightly off like we do in South Africa. So I cannot, maybe there's a different genetic pool in Europe. Maybe they have different people, I don't know. But in South Africa, what we know with Omicron is that it is really a mild disease. Most people at a community level will get better within 5, maximum 7 days. Yes, yeah, they will feel their body aches and pain and not feeling well for at least 48 hours. And then they get better. So if we look at that, if we look at, and if we look at the fact that South Africa, about 40% of adults has been vaccinated, and we look at the majority of young people not being vaccinated, and we look at the high incidence of HIV and the high incidence of TB, untreated or partially treated, as most likely because of the lockdowns that we had and people not adhering to treatment, then I would have expected to see more cases in my ICUs or in the hospitals if younger people are then not getting such a severe disease. But in the same thing, in the same breath, we are saying that people with comorbidities are at higher risk. So that's why I'm saying, so maybe there's something else going on in South Africa that is unique to South Africa and not to Europe.
So coming back to India, I'll just give you some perspective about India. Like we are a population of 130 billion and we have a quite, high density. And also we have not been able to vaccinate our, 100% of our adult population. And also we are quite high in numbers of the diabetes. India has seen the first case of Omicron in 2nd December and now the number has reached 100 within 15 days. So do you think that the threat perception looking at the vaccination status is quite high for India?
I don't think so. I think what India needs to do, again, the same question, how are the hospitals with Omicron? Remember, there's still Delta going around in some countries, especially in the European countries. We know that Delta is still there. So you need to understand who is lying in your ICU. Is it Delta? Is it Omicron? Is it a combination? I don't know. So as long as your ICUs are not overrun and your daily rates, infectivity rate are quite high, and it's not reflecting in ICU cases, then you might be on the same track as South Africa.
Right now, when we discuss about Omicron, we all know that it has already spread from one country to 80 countries now. So do you think that this concept of high risk or low risk countries should be there, or should we consider any foreign country as a high risk country and act accordingly?
All countries are high risk. There's no country that can say they're not high risk. All countries are high risk. It will depend on the immune systems of the country, the previous waves that country experienced, the vaccine effectiveness of what they are using and how good it protects, and the clinical picture of your doctors.
And if we talk about the symptoms, as you say, that the people needs to understand what are the symptoms. So if you can please elaborate the symptoms for our viewers, that what are the specific symptoms for Omicron, because nowadays the boundaries are very blurred between high risk, low risk countries. Everything is very mixed and very blurry, but they should know, they should understand the symptoms. If you can tell us about that, Dr.
Very important, very, very important. So it's actually easy. I wake up this morning because that's what they tell us. They go and they say, doctor, last night when I went to bed, I was fine. So during the night, I could have had a bit of, warm and cold, sweaty. But this morning, doctor, I had a headache. I've got a headache, a terrible headache. My body is sore. And I'm tired. It's as if I want to sleep. So the best, that's how they described it. And I can describe it in medical terms, and half of the people won't know what I'm talking about. But everyone would understand a headache and a sore body and a tiredness. Then they can, it's not to say they will, I can have a scratchy throat. A lot of people think it is a post-nasal drip, but it's actually the irritation of the virus. They can have a dry cough, and the cough is very, it's the same, it's a dry cough. They go like this. It's as if it's sitting here, okay? It's not a cough like you have a flu cough. It's not the same. And that's it. Because they don't have really temperatures. They don't have loss of taste and smell. And they all wait to get more ill because everyone told you this is a very severe disease. So I feel a bit under the weather. So we then advise the patients, wait at least 1 day. Just wait. If you wake up this morning, isolate, quarantine. Tomorrow morning, go and get tested, because we have seen that in some cases, the rapid test, if you wake up that morning with the symptoms, might be false negative, only the next day positive. And then go and see the doctor, that they make sure that you're okay, and if there's any treatment needed. And the treatment currently is so, it's around a low dosage of cortisone, as well as ibuprofen and Panado for those who can tolerate it and might be able to take it. And then rest. And between 5 and 7 days later, you will be fine. That's the symptoms.
So now again, another conversation, it's going around, especially in my country, where I belong to, India, is that the demand for a booster dose. Now, do you think there's a high time for India to go with the booster dose, or they should prioritize finishing vaccinating the entire adult population first and then go for booster dose?
It's a very good question. So what I think is important is that you need to try to get as much dosages in unvaccinated people's arms. That's the first thing. Your priority should be to try to vaccinate as much people as possible. Then you can run simultaneously a booster for those people who has been who is eligible for a booster. But you prioritize your 50 pluses. You prioritize your immune compromised, whether it's children and who has got one kidney, or who's severely ill, and your HIV patients. They are eligible for boosters. After you have done the boosters, and by that time, hopefully, you can open it for the rest of the population who has already been vaccinated.
So far in India, if we talk about the 100 cases we have seen of Omicron positive, we have one child, 7-year-old boy, who is also have tested positive for Omicron. So now you must have seen pediatric population, for Omicron virus. How severe the diseases are for the pediatric population, and how important vaccination for the pediatric population is?
Again, children, I only know of one 15-year-old that was severely ill and died. Whether that was due to Omicron, whether it was due to Delta, we don't know, because the PCR testing on the labs didn't give us that data. But all in all, the children also do quite well with Omicron.
All right. I'll not hold you for more. I have one last question left. It's a question for many of us, like all of us who are dealing with this pandemic for last 2 years. It's been 2 years, and you have seen more than 600 patients. You are in touch with many of the healthcare professionals. What do you think, and when we as the world population, we can see an end to this pandemic?
That's a difficult question, but if I can give an opinion, I would say I think it's going to become endemic, like flu or a severe cold going forward. If I look at Omicron and I look at the South African experience, not the European experience, please, South African, I would say, the virus got a lot of mutations. And if the mutations make the virus to be fast spreading, but much milder in the communities, it means something is happening. And hopefully, with further mutations, it will mutate to have even less mild infections. And it's also not in the virus' best interest to kill people, because in the end of the day, if he kills everyone, he's also going to die. So fast spreading, I think, I know it sounds terrible, but maybe because we have this high positivity rate and less sick people than we saw with Delta, for now, I would rather take a fast spreading super spreader variant with less virulency. And hopefully then people won't get very sick and they will build up antibodies on this.
Great. On this note, I'll end this interview thanking Dr. Quetzi for giving us your valuable time and also answering all these queries with a smiling face. Thank you so much, Dr. Quetzi, for that. And also, I would like to thank India's fastest growing doctors community, ClearNet, for connecting us with Dr. Quetzi. Thank you so much. Have a great day ahead.
Thank you.
নমস্কার, জি 24 ঘন্টা দর্শকদের জন্য এই ইন্টারভিউ এখানেই আমরা শেষ করছি। আপনারা দেখতে থাকুন জি 24 ঘন্টা। নমস্কার।